Bismillah, alhamdulillah, wassalatu wassalamu rasulillah. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. Ramadan Mubarak. May Allah subhanahu wa ta'ala bless your Ramadan and accept your Siyam, your Qiyam, your Tilawat al-Quran. This is a perfect opportunity for me, firstly, and you all to inshallah connect with Allah subhanahu wa ta'ala, improve our iman, and engage in significant acts of ibadah. This is for sure a blessed month that Allah subhanahu wa ta'ala has gifted the Muslim Ummah, and we should inshallah optimize and take benefit from it. I wanted to address substance use and addiction, specifically during Ramadan, because I know this can be a very difficult period for people struggling with substance abuse, and we do know that it is very common in the Muslim community. Some research says that at least 1 in 3 people in the Muslim community know a person who has or is struggling with addiction. So unfortunately, stigma surrounding substance use continues in the Muslim community, and this can be a barrier towards recovery. So this Ramadan is a perfect opportunity for those individuals who are struggling, for those families who are struggling with substance abuse, to inshallah make strides towards their recovery. So there's some pieces of advice that I'd like to discuss and outline. The first thing is, obviously Ramadan's already started, but we should prepare in advance. So those people who struggle with substance abuse should plan in advance of Ramadan, like how they will be able to manage, particularly things like withdrawal symptoms, because it can make it difficult to stay sober. So some kind of helpful strategies is, number one, to obviously make dua to Allah subhanahu wa ta'ala that He helps you get rid of this problem, this fitna, because dua is very powerful, no doubt about that. Secondly, try and set up a healthy support system. So Ramadan is a time when people look forward to towards coming together. There's much more community and family orientation, but the fear of being judged by others can keep someone feeling lonely and isolated. So this Ramadan, kind of tap into a support system, support network that will be there for you on the journey towards recovery. And this can be things like NA, Narcotics Anonymous, AA, Alcoholics Anonymous. Peer support is very, very important. Being around certain people in your life can be a trigger for use as well. So if you have that, have a plan to minimize interaction with those individuals during Ramadan who can lead to a relapse or a lapse, and this is important. Another piece of advice is to set realistic goals for Ramadan. We know that when Islam came to the people of Mecca, the Quraysh, who drank alcohol, it was not kind of outlawed immediately. So Allah subhanahu wa ta'ala gave His wisdom in terms of gradually making it unlawful or haram. So it didn't start with total abstinence. Instead, alcohol was forbidden in a series of 3 phases over the span of 17 years. So no matter how motivated you are, or you may be feeling about your recovery during Ramadan, abruptly stopping substance use may not be the best step for you. So again, depending on the substance you're using, or the severity of your addiction, sort of a cold turkey approach can be more harmful and lead to addiction. So to set safe and realistic goals for Ramadan, it's important to work with an addiction counselor or with your treatment team to see what is the best steps for you as an individual. So while the benefits and blessings of Ramadan are incredible, realize that recovery may take months, years, or even decades. So addiction is a chronic, relapsing, remitting brain disease, and unfortunately people can struggle with it for the rest of their life. So Ramadan might not be the month of complete recovery, but it can be a stepping stone towards leading a much healthier life. Another strategy is to apply healthy coping behaviors. So Ramadan is a perfect opportunity to substitute unhealthy coping mechanisms, i.e. using substances, with healthy coping behaviors. Okay. Also, stay hopeful when dealing with relapses. So some people will, unfortunately, during Ramadan relapse, And as I mentioned, recovery is a process. It often includes relapses. So relapsing during a day of Ramadan while fasting can be harder than relapsing on any other day. Obviously, people feel more shame for not only falling back into their addictive behavior, but also for breaking their fast. You may get negative feelings about yourself or question your sincerity about being a Muslim because of your struggle with addiction. Even some people experience suicidal thoughts. So piece of advice is not to give up. As Muslims, we should always be hopeful. Allah subhanahu wa ta'ala is Ar-Rahman, is Ar-Rahim. He will forgive us. If you do relapse, do a deed immediately, a good deed like giving sadaqah, which can expiate your sins. If you break your fast, talk to an imam, talk to a scholar to understand what you need to do to make up for breaking the fast. If you relapse outside of the fasting hours, then as I mentioned, give sadaqah, pray nawafil, read extra adhkar. Realize that how you deal with relapse is your key to recovery. So if you deal with relapses in a constructive way, those small bumps in the road will only make you stronger and closer to recovery. Also, the process of overcoming our desires is a shared struggle for all Muslims, and this process is continuous. So this process of having sabr, it will continue until we die. As you cope with your addiction, remember that Allah subhanahu wa ta'ala is Ar-Rahman. He knows that we are imperfect, and we should run towards Him to talk to Him and walk to Him, especially in Ramadan, especially in the last third of the night, when Allah subhanahu wa ta'ala descends in a manner befitting His Majesty to the lowest heaven. This is an opportunity to make sincere dua and tawbah, and know that there is reward in every step that you take on this journey. So specifically in terms of medication, for those people who are on methadone or buprenorphine, this is for patients who are having treatment for heroin. These medications are essential, should not be abstained during Ramadan, and we usually recommend, so if you're taking oral, which is a medication which is common to take it after you break your fast at night time, or if you're taking an injection, so you have injectables, you can take it during the day, it doesn't break your fast. Again, you need to speak to your treatment team for advice. With respect to heroin, stopping suddenly will cause withdrawals, but heroin withdrawal is relatively safe. It's not life-threatening. So Ramadan is a great opportunity for someone to get into treatment, to stop using heroin, like changing to a different method of administration. Someone using as normal but also fasting will become more sedated, more tired and nauseated. There is a higher risk of overdose, so please do carry naloxone, which is the antidote, which is life-saving. For those people who are drinking alcohol or using things like Xanax or Valium benzodiazepines, stopping suddenly will put them into withdrawal, which can be life-threatening, especially alcohol. So because of the risk, we encourage a safe reduction in intake during Ramadan. Anybody who is fasting is encouraged to speak to their treatment team. Inshallah, that was beneficial. May Allah subhanahu wa ta'ala give this blessed month an opportunity for those individuals who are struggling with addiction and families, the best time to recover. And if any of you do need more specific individualized advice, please do get in touch. Remember me in your du'as. Until next time, this is your brother Dr. Abu Isa. Assalamu alaikum wa rahmatullahi wa barakatuh.